Facebook, YouTube Live. As you will see, complete N block 12226, initials NW. So this is a patient, 45 years of age, who had one set of implants 2014. And so she had the symptoms, a nice patient nurse. So she comes in with a lot of complaints of what is breast implant illness, plus her 12-year mark, and she certainly wanted them out. Also of note, as you can see, that this right implant, the right side, end block, the gold standard, completely removed. This was protruding out. So she got an ultrasound and they were like, what is this? Is it a fold? Is it ruptured? She had a mammogram as well, and you can see, look at this pointiness right here, and it is not uncommon. She had a grade 3 capsular contracture on the right and grade 3 on the left as well. So I cut out the excess skin to help with the contouring. You can see this excess skin. This is some of the tissue I removed at the bottom. I'm going to send you the capsule. You can see how thin the capsule is. You can see these white stripes. They're suggestive of what is a Sientra implant. And again, very thin capsule. And so we do not know if this is ruptured or not, if this is a capsular contracture. Now remember, as a plastic surgeon, you have to always assume that the implant is ruptured, because you don't want to find out otherwise. There might be fluid on the inside, there might be ruptured. We do not want it to leak out. So we're going to just find out right now what it is. Complete removal of the entire implant and end block, the gold standard. And so we will see what it shows. And you get to see exactly how thin this capsule is. So as soon as I make the cut, again, you want to be very careful that I don't want to hurt the implant. You can see there's some fluid wanting to come out. It's a textured implant for sure. So one thing I want to do here is I'm going to take this ruler and I'm going to slide it underneath. And you can see, look how thin is this capsule. No matter how thin, this capsule has to be removed in my practice. And so I see some patients said, oh, my surgeon left the capsule behind. No, it has to be removed, because remember, that's the whole goal and gist of the surgery. So now, because of the textured nature, you will see how tightly it sticks. You can actually hear the bubble wrap sound. Now this is a nice soft scissor, and now I've made the path. I'm going to go in and open this up. And you can see how this is, because it's textured, it's super tightly adherent. And that's the purpose behind it. And remember, this is, look at this, how it's bunched up. You see two separate lines? No, it's one line, because of the way how it's indented inward on itself. Alright, so you can see, look at this. This is part of the capsular contracture. I'm going to cut this here again to show. And look at the way how this is a small amount of fluid. What I'm going to do is, just to be complete, anytime you have fluid around an implant, you have to aspirate it. There might be a lot of it. So more, can I get the syringe, please? So anytime you have an implant and you have fluid around, you have to collect the fluid. And that is proper etiquette. We might have a lot, we might have minimal. Yesterday we had almost 75 cc's. So you can see none of this spilled into the chest, and that's the whole goal and essence of the surgery. No matter how thin the capsule, the end block has to be done in a very sophisticated way. And you can see this bump that you're seeing, how it's gonna be evident. Now, guess what? I'm seeing some more fluid here. I'm gonna collect it, gravity dependent portion. Intact implant, as you can see. And I am going to, you can see, look at the fluid. None of this spilled into the chest. Now remember, your surgeon has to show one video after another, maybe every single time, because you want to make sure this fluid is enough to send to cytology. And this is a reasonable amount of fluid, you know, and I did not know she had a rupture or not. I did not know about this fluid, and this is where you have to always assume it's a rupture. You have to always assume there is fluid, and this is the proper etiquette of an explant, because you never know what you're going to find. Look at the Facebook Live from yesterday. Look at the Facebook Live today. And that's the whole goal and essence of this surgery. So you have this almost 3.5 cc's of fluid. I'm going to stop right here. And you can see, look how saran wrap thin this is. Again, you saw the ruler. No matter how thin it is, it has to be done in the manner as described. And complete entire implant capsule removal. I'm going to send this tissue that was at the bottom along with this. I have sterile gloves, 2 pair, and I'm going to remove the top sterile glove, because remember, I want to be able to get a good representative sample of this fluid on the inside right here. Now, fresh pair of gloves, sterile, left side. I cut out that skin. This is the tissue. Again, end block. You can see right here, complete entire implant capsule. You can see how it's bunched up already. You can see that white line running up. And just like we did on this right side, on this left side, I'm going to cut this open. Now, before I do so, I want to go ahead and highlight the Kahn procedure. You can show this over here. No lift. This patient actually has done extremely well with no lift. No drains. Clearly the blood loss was like 5 cc's on each side. The capsule will still be sent to pathology. Cultures for aerobic, anaerobic, and fungal sent to microbiology. High definition pictures and videos of what you're seeing here, but more importantly of the chest wall, showing complete removal of the entire implant capsule. This is by far the most important thing, if you ask me, that kind of validates, authenticates the quality of the surgeon, if you ask me. The high definition pictures and videos. I have yet to see a surgeon showing high definition pictures, videos of the chest wall, showing repeatedly complete removal of the capsule, because that's the ultimate check. Deep sedation, twilight, no paralysis, the ventilator is not breathing for the patient. Implants are always given to the patient. All capsules, no matter what, are removed, and all patients get the same surgery. And remember, this whole surgery is about the capsule and that inflamed tissue around. What do I mean? Look at this tissue around. Look at this tissue. It does not look good. It looks abnormal. Let me go ahead and cut over here. And as you will see, this tissue is not healthy. You can see it's scar type consistency. So I'm going to go in. I know it's textured, so it's going to be very tricky. I do not want to hurt the implant. Again, we do not know. This could potentially be ruptured. So I'm going to go right here. See, there's a crack right in the middle of the crevice inside. I'm going to see if I can enter over here. Let me go in here. It's super tightly adherent. You can see from the right side how super glued it was. This is a good purchase. Here we go. Look at the way how it's bunched up. You can actually hear the capsule being cut. An intact implant. I'm going to cut this open here, and then I am going to... So the way the textbooks describe, if they're doing it inside a replacement, I put my finger and I basically finger dissect, and I remove this implant. Look at the fluid again. Look at none of that spill into the chest. Now this is the whole essence of explant surgery. If you're not thinking en bloc, this fluid will inevitably end up spilling into the chest and block the gold standard. And I want anyone to challenge what I did as being exaggerated, invasive. No, this is again pretty much the same volume, 4 cc's, a little bit less. And the surgeon should show disgust and should be excited about these procedures, not like, you know, the whole focus here is doing the right surgery. And as you can see, look at this mustard colored seams. If I go like this, look at this soft tissue irregularities, masses. There's what is a hemorrhagic area to it. And so this is all of this bad tissue, as you will see. Look at this soft tissue irregularity right here. All of this will be sent to, including this. So the bottom line here is you can see, look at this intact implant. Now the other thing I want to show here is these are your Silicone 425. And if I go like this, look at the fluid that's around. And there's a lot of information that's in it. Remember, this is all sterile. And I'm just going to basically put it right here. I want to pull out as much because I don't want my pathologist to say they didn't get enough of a sample. But this is more than 3 cc's. And remember, none of this spilled into the chest. Very slimy, intact silicone implant. So there you have it. As you can see, the Khan procedure again, 20 years from now, I cannot imagine anyone else doing the surgery any better, any different, any more complete, or any more comprehensive. The implants will be returned to the patient, capsules to be sent to pathology, cultures for aerobic, anaerobic, and fungal. No drains, no lift, twilight, deep sedation, implants to be returned to the patient. And then the high definition pictures and videos of what you see right here, certainly the patient will see, and absolutely of the chest while showing complete removal of the capsule implant and all that fascia of the pectoralis major that was removed along with the implant capsule, such that this patient got a comprehensive, complete, defined surgery. All the badness was removed, and all of it is going to be tested so we know what it is and what it is not. This is Dr. Khan, Executive Plastic Surgery.